Biometric registration frequently asked questions. Is NHIF undergoing digital transformation? Yes. NHIF is undergoing a digitization process for its members and hospitals to implement the proposed NHIF reforms recommended in the Health Financing Reforms Expert Panel (HFREP) report. This will transform and reposition NHIF as a strategic purchaser of health care services and scale up of universal health coverage (UHC). The digitization of the processes at NHIF and the hospitals will enhance efficiency in service delivery because of an increase in membership, claim management, and monitoring of the same. What is the procedure of biometric registration? You and or your dependents can visit the nearest NHIF branch offices across the country and produce identification documents, i.e., copy of the National Identity Card or NHIF card for verification in the database. You can also be registered biometrically when you visit the NHIF contracted hospitals seeking services. Once identified, NHIF/hospital will capture your fingerprints details. In addition, NHIF/hospital shall also capture the 10 fingerprints of all your dependents. You will also be registered biometrically to the NHIF database and registration number if you are a new member. When you or your dependents visit an accredited facility of choice, you will be identified using your fingerprints or one-time password (OTP). What if I am handicapped or have no fingerprint? If handicapped or have fingerprint challenges due to medical or other conditions or children below 7 years of age, you will access services at the hospitals using a one-time PIN (OTP) sent to the principal member's mobile device or through pre-authorization. What is the importance of biometric registration to members? The use of biometrics will increase the accessibility of services for the principal members and their dependents. All they need to have is their biometrics to be identified and verified wherever they are. A member, for instance, can get into an accident and the people helping might not be able to access the wallet for them to get the NHIF card and ID as a mode of identification, but can use one of the fingers to identify and verify the member quickly. Where can I access biometric registration? You and your dependents can register biometrically at any NHIF branches countrywide. If unwell and not biometrically registered, the hospitals will first carry out the biometric registration before accessing any services from the hospital. Therefore, NHIF has empowered and equipped accredited hospitals to ensure that they can biometrically register before members seek services. The process will continue until everyone is registered. When is the biometric registration exercise expected to end? The registration process for the members and dependents is a continuous process with no deadline. However, at the point of seeking services at the hospitals, the members will be prompted to undertake the biometric registration first. Therefore, you are encouraged to register before seeking the services through NHIF branch offices and satellites countrywide to avoid inconveniences. Most NHIF members have their physical cards. Will they be given other cards after biometric registration? No. Instead of the NHIF card, your fingerprints will be the mode of identification. What will happen if I am in a different town from my dependents and they need medical services? This will no longer be an issue for you and your dependents. Each individual in the family will be registered biometrically and identified as such at the hospital. If your dependents are in a different town, they too should visit the nearest NHIF branch or satellites to have their biometrics taken. Remember, the details of your dependents are already with us and all they need to carry is their identification for verification. There is no deadline for biometric registration since it's an ongoing process. If you or your dependents are unwell and are not biometrically registered, the hospital will capture the biometrics first before accessing any services from the hospital. What is the impact of the e-claim management system deployed in hospitals? The interfacing of the NHIF system and its network of over 8,000 hospitals systems will ensure real-time payment of claims and reduce abuse, fraud, and wastage. The ongoing digital transformation will improve efficiency and reduce fraud, wastage, and abuse. This is part of the transition and transformation of NHIF as the vehicle through which the government will attain universal health coverage. For more details, contact NHIF on toll-free number 0800 720 801.